Hi, it's James from decaf.com, the UK's leading decaffeinated coffee brand. Today, we're going to ask the question: does caffeine and regular caffeinated tea or coffee affect fertility, the ability to conceive and pregnancy? First of all, the studies here are not conclusive, and we believe that a lot more research needs to be done before we can be really sure about caffeine's effect on fertility. Several studies have shown that caffeine can increase the length of time it takes to conceive. One study showed that women who drank more than 1 cup of caffeinated regular coffee a day were half as likely to become pregnant per cycle as compared to women who consumed less. Another research study in patients undergoing IVF treatment demonstrated that women who consumed even modest amounts of caffeine, such as 50 milligrams, were likely to have decreased live birth rates. So, why would caffeine have an effect on fertility or conception? While the exact mechanism by which caffeine affects fertility is unknown, the answer may be related to the ability of caffeine to influence the quality of the developing oocyte or egg. Preliminary studies in mice and monkeys suggest caffeine inhibits oocyte maturation. An immature oocyte does not fertilize and therefore is unable to produce a pregnancy. And does caffeine affect pregnancy? It is already well known that it's prudent to avoid or control caffeine consumption when pregnant. Some women drink decaffeinated coffee to help with this. Multiple research studies have suggested that caffeine consumption can increase the risk of miscarriage. Indeed, women consuming greater than 200 milligrams of caffeine per day had twice the miscarriage rate, 25.5%, as compared to non-users, 12.5%. In addition, pregnant women may be more sensitive to caffeine as it is metabolized or broken down slower during pregnancy. Caffeine can also cross the placenta and directly affect the developing baby. With most studies indicating that the effects of caffeine are related to amount of caffeine consumed, it would seem prudent for women contemplating pregnancy to limit caffeine consumption. But it's important to note that women who are large consumers of caffeinated beverages should gradually reduce their caffeine intake gradually to avoid withdrawal symptoms such as headaches, irritability, restlessness, and nausea. So, is decaffeinated coffee suitable for fertility consumption and pregnancy? Decaffeinated coffee has very low levels of caffeine, so it's a safe way to reduce caffeine consumption and still enjoy coffee, but without the caffeine. Here at decaf.com, we recommend the Swiss water process of decaffeination, which uses water, no chemicals, to decaffeinate the coffee beans and is 99.9% caffeine-free. To find out more, please visit www.decaf.com or check out our YouTube channel for more videos on decaf, caffeine and coffee topics.